Hi, I'm Mackenzie,
Hi, I'm Esmeralda.
Hi, I'm Melanie.
And I'm Taylor.
and we're group two, and we're doing the module one discussion for types of communication between professionals. And then for our first question, we have what communication channel was Jane suggesting that Lucy uses? And we came together and decided that the grapevine channel was the best option because it was informal and spoke out of the chain of command. And Jane was suggesting to Lucy that she should communicate with the manager and not another nurse so that she could voice her concerns without getting in trouble and so she could have her issues figured out directly.
Yeah,
Yeah.
I also said the same thing because Grapevine is informal and it's just 3 to 4 people at any level. And there's often like a lot of errors with this communication channel.
Yeah, perfect. I also said the same thing. And then in continuation, the second question that we had was what communication technique was Jane using when talking with Lucy? In conclusion, we all discussed and got with passive aggressive because when Jane and Lucy were talking, she was like when looking at passive aggressive, you're looking at instances like gossiping, sarcasm, and like excluding people from a conversation or a group. And by doing so, like Jane was suggesting to like Lucy to forget and avoid the chain of command and go straight to Lucy, which is considered passive aggressive for us.
I completely agree.
And I think we also said something about supporting technique.
Oh,
Yes, that Jane used what seemed like a supportive technique and she tried to acknowledge those feelings and listened and gave some solutions. But yeah.
Okay, and then I have a question C. What communication channel was Lucy planning on using? Lucy was planning on using the continual channel. Um, and she was planning on using the chain of command to talk to the charge nurse, to then talk to the manager. Um, and this is using the superior and subordinate communication. Um, that's pretty much what I said for that. I don't know if you guys agree or if you have any
Yeah,
comments.
I agree with that. So out of the 3 channels, diagonal, continual, and grapevine, continual is definitely like an effective chain of command to use or channel. So I think that was good.
I agree, yeah.
same.
And then for question D, it says, what was the difference between the ways Lucy communicated with the physician on the phone and with Francine and then with Jane? So with the physician, I think that Lucy was assertive because she was respectful, confident, and she also followed S-bar when discussing her client's situation. And then towards Francine, I would say she was passive, just because it was hard for her to say no, and she had pretty nervous body language. And then with Jane, I think she was assertive again, because she was still respectful as she declined Jane's suggestion, and she followed the chain of command, which was good. And yeah, like I said, she was confident and clear in that discussion.
Yeah, I agree with that too. I also said like for Lucy, how you said that you believe she was assertive. I also believe that because when you're being assertive, I feel like you use like I statements a lot, like, okay, I understand. And I kept seeing that she kept repeating that over, meaning that she was like actively listening to the conversation and like making sure she understood and having the person know that she actually understood what's going on.
Right. And that also shows confidence too. So
That as well. Mm-hmm.
I also agree with Jane being an assertive communication style as well because she was very clear and direct and seemed like she really expressed her needs.
right.
Yeah.
Yes, yeah, and it overall made her sound like respectful and overall just more professional.
Yeah. Yeah, like respecting her own and Jane's suggestion. So
Mhm.
and then lastly, we're going to discuss the possible conversations that could have happened between Lucy and Francine and also between Lucy and Jane. So firstly, does anyone want to say anything about Lucy and Francine?
I have a few on Francine. So Francine could have most definitely been more respectful towards Lucy's time. And she could have approached her in a more assertive and professional manner. I feel like that would have carried out the conversation a little less passive and intense, and it overall would have de-escalated the whole situation.
I agree. I feel like if she used an assertive tone that no one would feel disrespected or awkward in their own workplace instead of feeling like they were being argumentative towards them or confrontational.
Right. And I
Yeah.
think in turn that also just led to Jane hearing about this and then starting a whole gossiping and then her being passive aggressive, so I think that definitely could have changed the situation.
Yeah, I also saw that too. Like, if I was in like Francine's position, like, and seeing how stressed Lucy was already after like hanging up on the phone, I personally would have probably like just been like, okay, like, is there a way like you can cover for my like my round for like at least like within the next 10 minutes while you're able to like settle down what you have? It would probably be less for her to be less aggressive would have been a better outcome.
Yeah.
And would have avoided like everything that happened now.
I know Lucy handled the situation as good as she could have, honestly, because she knew to follow the chain of command. So I think she did the best she could. And then as well as Jane, I know she was trying to give her advice. I don't know if you guys noticed that.
Mhm.
She meant well, but she kind of was a little bit of an instigator.
Right. It
Yeah.
wasn't very professional. Yeah, I agree. What do you guys think would have happened if Lucy did take Jane's suggestion towards the end of the case study?
I feel like it would have been the situation would have escalated a lot more, especially since Francine was already like in an aggressive like manner, like way. She's probably gonna be like, okay, like she's gonna feel confronted in a way. I'd probably be like, they probably have a whole like argument probably, and it's just gonna be a mess, if you ask me.
I agree. Yeah. So I think, does anyone else have anything to share?
I was gonna say, I think if in all of these situations everyone was just respectful and assertive and followed their chain of command, there could be a lot less issues and drama going on inside the hospital between all of the nurses.
Yeah, for sure. I think so too. Yeah, assertive is definitely the best communication style for sure.
I believe so too.
So I think this concludes our discussion.
Yes.
Thank you.
Group 2 discussion post with Module 1, types of communication between professionals.
Yeah, go group 2.